So one of the aspects of the test that's important as a gastroenterologist is that you can make a definitive diagnosis early. Think about the 25-year-old patient in your office who has these nonspecific symptoms. Maybe you want to do a colonoscopy to rule out inflammatory bowel disease. Or maybe you want to do this test, and if it's positive, maybe you can go ahead and treat as irritable bowel syndrome before doing the colonoscopy. Think about the patient going through the prep and all of the effort and morbidity of a colonoscopy in a young person. So you can get the diagnosis within a couple of days. There are also patients in your practice where they're frustrated. They feel like they want an answer. And as much as you can assure them that your experience tells them this is irritable bowel syndrome, maybe they're struggling with the treatment. Maybe they don't feel like this is the correct answer. This can reassure you and the patient in your office that this is the answer to their problem, that they actually have irritable bowel syndrome. The other part of this is that as a gastroenterologist, if a patient has positive or elevated antibodies, you might want to counsel them about food poisoning because, first of all, as I mentioned earlier, IBS leads to a higher risk of food poisoning when you travel or just in general. Secondly, you counsel them more aggressively about safety during travel because these antibodies could elevate further with another episode of gastroenteritis. So it helps the gastroenterologist in a number of ways in managing their patient.